Hey, you're welcome back to Virtual Antenatal Class with Taiwo. If you are new here, my name is Taiwo, a registered midwife, your pregnancy coach, and friend on this amazing journey to motherhood. So today we are diving into something very important but misunderstood sometimes, and that is placenta conditions in pregnancy. Don't worry, this is not to scare you, but to empower you, because when you understand something better, you can prepare well. So, a few years ago, I met a young pregnant woman. Her name was Kemi. She was about 7 months pregnant when she noticed some bleeding, not heavy, but enough to scare her. So she rushed down to the hospital. After some checks, the doctor told her she had a condition called placenta previa. Kemi had never heard of it before, but with the right care, some rest, and a planned delivery, she gave birth to a healthy baby boy. So, what exactly is placenta previa? Placenta previa happens when the placenta, the placenta is the organ that feeds and protects the baby, right? So this placenta settle too low in the uterus and end up covering the cervix. That cervix is like the exit door for the baby during delivery, like it's the door of the womb, which we know as uterus, right? So we have different types of placenta previa. We have the complete placenta previa, whereby the placenta covers the whole cervix, that is the whole opening, right? But we also have partial previa, which cover part of the cervix, not covering the whole part. And we have the marginal, which is just at the edge. What do you watch out for? You watch out for painless vaginal bleeding in the second or third trimester, or maybe there is no pain but red bleeding. And how do you manage it? You manage it by regular monitoring. You monitor that blood that is coming out. Then you ensure bed rest, and it's often delivered by cesarean section in order to protect both the mother and the baby. Another we'll be talking about is placenta abruption. This one is more dramatic. Just imagine the placenta, they're supposed to stay attached to the womb until after delivery. Suddenly starts pulling away before the baby is born. The placenta attached to the body of the womb, right? It's now coming out, it's now detaching before you even born baby. That is what we call placenta abruption, and it can make the woman to have abdominal pain, bleeding, tight and hard abdomen, and sometimes the woman will have reduced baby movement. It is an emergency, so any bleeding with pain, or maybe you're having a strange abdominal cramp, you don't have to stay at home, go to the hospital. Another condition is placenta accreta. This one, the placenta grows too deeply into the uterine wall, like into the wall of the womb. It is very, very deep. So this one is not usually painful, but it is picked up during scan or sometimes during delivery, where the placenta is not able to be delivered. What are the risk factors? Cesarean section, uterine surgery, or multiple pregnancies. That is, those people that have had multiple pregnancy, uterine surgery. And why is it very serious? Because if the placenta does not detach easily after birth, it can lead to severe bleeding, because once the placenta is not deeply attached and the baby is delivered, you deliver the placenta easily. But now it is deeply attached, so it will be very difficult to be delivered after delivery of the. Now, speaking about after birth, let's talk about retained placenta. That is, after the baby comes out, the placenta refuses to come out naturally within 30 minutes, and this can cause heavy bleeding or infection. In such cases, the midwife or the doctor will help to remove it manually. Now, listen, mothers, I'm not sharing all this to scare you at all, but many women like me go on to have healthy, happy baby, even with this condition. But I want you to know that the key is early detection and regular antenatal care. So if you are feeling any pain, any bleeding, or just feel something is not right, Speak up. Do not keep it to yourself. Ask questions. Stay informed. You are not alone in this journey. You know, I always say this. Now, as a way of recap, we say the placenta is your baby's best friend, but sometimes they need special attention. So do not ignore any bleeding whatsoever in your pregnancy. Do not ignore any abdominal pain in your pregnancy. Watch out for this that we have explained. So I want you to share this with any pregnant woman that you know, and make sure that you follow our page so you don't miss on our next class. See you next time. Bye.